Hello, my name is Karen Bowen, and I'm here to deliver my speech on diabetes in children. At this time, I'm going to pass out some information, and I would like for you to follow along with me as I talk about diabetes in children. First of all, I want to start out by letting you all know that there are two types of diabetes. There's a type 1 diabetes, which is insulin-dependent diabetes. That means that a person or a child, an adult or a child, they will have to use insulin if they are diagnosed with type 1 diabetes. Type 2 diabetes is non-insulin dependent. That means that a child or an adult will have to take a pill either once or twice a day. The importance of education in diabetes. When a family first finds out that their child is diagnosed with diabetes, they have to visit the clinic at least 2 to 3 times a week. And that's just to get educated on how diabetes affects the body, what is needed to control your diabetes, and they also have to return a week later. First of all, I'm going to start out talking to you about the causes of type 1 diabetes. There are believed to be 3 things that causes type 1 diabetes. The first is genetics, the second is self-allergy, and the final is viruses or chemicals. Genetics. Genes come from both your mom and your dad and can make up some more likely to get diabetes. Over half of the people that get type 1 diabetes have inherited the gene cell types, which are DR3 and DR4. In self-allergy is when a person's body develops an allergy against one of its own parts. In this case, the allergy is against the islet cells in the pancreas where insulin is made. When the islet cells have been damaged, the immune system makes something called antibodies. These antibodies are present in the blood, islet cell antibodies, or ICA. The last type is virus or chemicals. Having a certain gene makeup may allow a virus or chemical to get to the islet where insulin is made, and it causes damage. Once the damage has occurred, the self-allergy likely begins. I'm going to talk about type 2 diabetes, which is non-insulin dependent. Type 2 diabetes is the most common type to occur in adults over age 40 years old. It is also particularly in overweight teenagers. It is quite common in Native Americans, and at least half of African American and Hispanic youth with diabetes have type 2 diabetes. The causes of type 2 diabetes is partly inherited. Some of the symptoms for type 2 diabetes is frequent drinking of liquids, frequent urination, and infections. Next, I want to talk to you about what is diabetes. Type 1 juvenile insulin-dependent diabetes is due to not enough insulin being made in the pancreas. The most common signs are frequent passing of urine, constant thirst, and weight loss. Up here, I have my chart which describes the blood sugar glucose testing when 4 or more times each day, usually before meals and at the bedtime snack. Food should not be eaten within 2 hours before a test. At least once weekly, 2 hours after each meal. Anytime the symptoms of low blood sugar are felt, and occasionally during the night. Anytime unusual symptoms occur, you should check your blood sugar. I have a health pyramid that I have made, and it has discretionary calories, sweets, junk food, no more than 15% of daily calories. I have a chart that tells you your dairy, you should have 2 to 3 servings per day. Your protein is 2 to 3 servings. Your vegetables are 3 to 5 servings. Your fruits are 2 to 4 servings. And your grains are 6 to 11 servings. You should also make sure that you exercise at least 30 minutes a day each day of the week. I also have some helpful information on diabetic snacks. 1 carbohydrate choice equals 15 grams of carbohydrate. And I will just give you some examples that I have. Half an English muffin, that will be for breakfast. You could have a half a cup or 4 ounces of orange, pineapple, or cranberry juice. Also, you can have maybe for a snack at lunch, 3 cups of popcorn, popped, 1 slice of bread, 1 small fresh fruit, and the list goes on. You also want to make sure that you add some protein for a balanced daily snack. And that could include a 4th cup of tuna, 1/2 cup of low-fat cottage cheese. I would like to end by telling you the prevention of diabetes. There are several trials that are currently taking place. It is likely that prevention will come before a safe cure.